Hello, this is Dr. Gay from First Look MRI, and this is a 52-year-old female who complains of left shoulder pain following a motor vehicle accident. The doctor did some plain x-rays here, and we see that the humeral head looks good. This is the clavicle, this is the acromion, this is the AC joint. There's no AC widening, so there's no obvious evidence of AC injury here. And again, no fracture, so they did an MRI scan to see if there was a tear of the rotator cuff. So this is the supraspinatus muscle, this gray thing, going over the top of the humeral head and attaching here. And that looks like within normal limits. There's no complete tear. A little bit of brightness within the rotator cuff, maybe a low-grade strain or tendinosis, but no tear of the rotator cuff, which is great. But she did have a finding here in the AC joint that we didn't see on the plain x-ray. There's no widening, but there's fluid, which you can see on this view, in the AC joint, which is abnormal. And also the AC ligaments that wrap around. We can see the superior portion right here coming up, this dark band and ending, and there's a little gap here. Along the inferior margin is poorly defined, either a high-grade partial or a complete tear there along the inferior margin. So this is a AC ligament sprain. Again, there's no widening, so this is a really prominent grade 1 or maybe even a grade 2 sprain. But again, there's no widening of the AC joint, but this is why she's having her symptoms, I believe, from an AC ligament injury. But you may also have noted that there's something else going down here. This is a bone lesion in the humeral shaft or the humeral diaphysis. So we have the round ball of the humeral head, we have the neck or metaphysis area here. This is the shaft or diaphysis. We see this bone lesion. It's hard to see on x-ray. We see a couple little flecks of calcium, but really we don't see any bone lesion here. And on this view here we see, this is called a T2 weighted sequence. We see the lesion is more intermediate to low in signal, and there's a couple little flecks of low signal which correspond to the calcifications over here. And if we put up another view here called a T1 weighted sequence, we'll be able to see that the lesion is dark on T1 weighted images, or there's low signal on the T1 weighted sequence. You can see little rounded areas of low signal. And on this view here, this is called a proton density fat suppressed sequence. We see it's very bright. So when we see really bright signal like this with little rounded whorled areas, we think about a chondroid matrix. Cartilaginous material look bright here and dark on this. Also, we note that this lesion is not aggressive. It's what we call non-aggressive. It has sharply defined margins. You could take a pen or pencil and mark the contour with a sharp line. We see a little bit of lobulation of the contour, and we see that the bony cortex here is nice and uniform. There's no scalloping of the inferior or inner margin, which we call endosteal scalloping. No endosteal scalloping. There's no bone expansion. There's no perilesional edema. No edema around the periphery. So these are all features of a non-aggressive lesion that is likely benign. And because it has this cartilaginous or chondroid matrix, we think this is a benign enchondroma. And this is a really classic look for an enchondroma. It has these whorled areas or rounded areas of hyperintense signal on the PD sequence. It has low signal on the T1 sequence. It has lobulated lobulated margins that are sharply defined. Sometimes they can be expansile, and sometimes they can have endosteal scalloping, but in a long bone like this is a really classic appearance. Now sometimes you can have some more aggressive features, and it can be hard to tell. Is it just an enchondroma, a benign chondroid tumor that just has some mildly aggressive features, or is it a chondrosarcoma? And sometimes you cannot tell them apart. But in this case, this is a classic case of a benign enchondroma, benign lesion, and they can follow this on x-rays or MRI and just make sure it does not change. If this ever did enlarge or become painful, then they'll be worried that it had converted over to a chondrosarcoma. But in this case, a benign bone lesion found incidentally. Sometimes these can cause the bone to be weak, and they will get a pathologic fracture associated with them. And so they will note that that's there and just watch it. And that's it. Thank you very much.